My name is Jessica Fay and this is my assignment 10, my presentation on the roles and responsibilities of healthcare professionals. To define a healthcare professional, they are qualified practitioners who belong to a particular speciality or discipline who are allowed by their regulating bodies to provide specific healthcare services to patients. Healthcare has always been essential to human survival, and anthropologists have found evidence of prehistoric surgical procedures such as trephining, seen here in figure 2, this one and here, where a hole was bored into the skull to relieve intracranial pressure from injury or illness. Healthcare was once dominated by doctors until the 1900s, when other healthcare professionals developed since the emancipation of women and then scientific and technological advances. The development of medicine has been influenced by a number of things over history: superstition, magic, folklore, religion, poverty, pestilence, so the death by epidemics such as the bubonic plague, and warfare. The different healthcare professional roles have been shaped by cultural, political, social and scientific developments. Then the development of the radiographer. So radiographers are part of the wider medical team, and they use highly technical equipment to take internal images of patients to diagnose injury or disease, and can also treat patients with cancer who have cancer with radiotherapy. Roentgen, who was the head of physics of a university in Würzburg, Germany, discovered the X-ray in 1895. In only 1901, he was awarded the first Nobel Prize for physics. The initial apparatus of an X-ray machine was a tube with a partially evacuated glass bulb with an anode in the side arm, and then cathode rays, which were electrons, were aimed at and would hit the end of the glass bulb and emit X-ray. This resulted in an image, though it was poor quality. X-rays were first performed by doctors and nurses, and by 1903 they had recruited lay operatives with no special training to assist the doctors and nursing in taking X-rays, and as these became too plentiful, it became necessary to train them, which is when the first radiographers became. So in 1920, the foundation of the Society of Radiographers was formed. I have now the impacts of the radiographer, so the political changes. So you have the NHS Act 1946 was brought in to provide the British public with a health service which would improve the general health and well-being of the population. Central government determined the spending budget for the public health sector, which can obstruct the use of more innovative technologies that would increase efficiency for healthcare professionals, especially radiographers, when the technology is particularly expensive. The Patients' Charter 1999 was designed to increase accountability in healthcare professionals. This means radiographers were more transparent and admitted fault, which then made them more liable if mistakes occurred. This would build a more trusting relationship between the healthcare professional and patient, and patients became more involved in decisions about their own healthcare. Working for Patients 1989 was added into the NHS and Community Care Act, so that hospitals and community trusts manage themselves, which gave them a bit more freedom to make decisions with their own budget. These changes involved the patient more in their own healthcare, gave the patients more autonomy, and improved relationship between radiographers and patients. Then we have the economic changes. So as you can see, budget cuts. So this has caused many professionals to work under a lot of pressure. Where staffing is tighter due to cost, this increased the risks of human error. Managing new technological advances and their costs, inflation, and when the spending aims to achieve the greatest health for most people, there will always be people left out, especially with demographic shifts. For example, if one district has many more older patients compared to other areas, or more poverty and therefore more health problems. In North Yorkshire in 2016, for example, the local authority put a 12-month ban on all non-life-threatening surgeries for people who were obese or smokers, which critics have argued was denying people their human rights. And there could be more of this with the budget cuts. This has also led to increased pressure for healthcare workers and even strikes about pay. And we have social changes. So social changes have shaped the roles and responsibilities of radiographers for reasons such as pressure on services, as technology has advanced, and funding. For example, exploratory surgical procedures are a lot less likely nowadays to be the first thing that a doctor would recommend. The first thing now with suspected foreign body, for example, is a scan of some sort, and then now it's an expected essential for emergency departments worldwide, things like MRIs, CTs, and X-ray. The increase of average life expectancy has no doubt increased pressure and because of numbers of patients assigned to one community hospital. The connection between poverty and ill health has been recognised. Health education and promotion. Introduction of clinical care pathways, which enables better communication between healthcare professionals who look after a patient. And this has led to an increased patient expectation, greater public awareness, increased pressure on services, but also a better general attitude towards health. Technological changes, if it will move. So technological changes that have occurred, like the development of CT scans and MRI only in the 1970s, which have avoided many unnecessary operations and other invasive procedures. Information technology has made it a lot easier to scan and send images to other professionals to review and compare and store the images. This has hugely impacted radiographers, increasing their workload where patients might have undergone exploratory surgeries, like I mentioned before the scans were developed, increasing pressure, but also making some things like sending X-rays, images quicker and more efficient, and ensuring that it goes to the right person. Less hospital admissions, shorter stays for patients in hospital, lower costs in procedures like the before mentioned operations, more sharing of expertise across geographical divides, earlier interventions, and better patient prognosis. And lastly, organisational changes, like the reorganisation of the health service, for example, when the Safer Patient Initiative was brought in after the Francis Report of 2013, found that there were patient safety problems in all NHS systems. Staff capability needed improving, and so a large-scale intervention took place which increased awareness of avoidable harm and patient safety. These impacts are also that staff became more specialised, further training, higher quality care was given, clearer communication between healthcare workers, and improved patient safety. I also found that the COVID-19 pandemic caused extreme pressure for radiographers. This has been because some surgical procedures for cancer were stopped, and therefore patients were given longer chemotherapy and radiotherapy courses as treatment. This increased the radiographer's workload in many places in the country, along with having staff shortages, and then staff would inevitably have to isolate at times. Moving on to a discussion of the role of the professional bodies. So regulators protect, promote to maintain public health and safety by requiring, restraining and putting conditions on professional healthcare practice that can be enforced. So the Health and Safety Executive, for example, is one of them. It's an independent national regulator of health and social care settings, which issues mandatory guidelines for health and safety at work. Potential hazards at work, all workplaces, will be moving, handling, slips, trips, falls and sharps, especially in healthcare. And then we also have the CQC, Clinical Quality Commissioner, which inspects and publishes performance ratings. Registered providers must meet national standards and regulations of quality and safety, and this is accessible for all patients, and then can equally add to the transparency and trust from patients. Role of professional regulating bodies. There is a statutory regulation of 32 professions across 9 professional regulating bodies. The PSA, Professional Standards Authority, oversee regulating bodies to maintain public safety and standardisation. So this ensures proper standards maintained by the regulating body, by all of the healthcare settings, maintain an up-to-date register of healthcare professionals, set standards for education, training and code of conduct, and investigate when standards aren't met. Examples down here are the Health and Care Professionals Council, which regulate 15 health, psychological and social work professions, including radiographers. Then you've got the General Medical Council, GMC, which sets standards for doctors, provides doctors with a licence to practice and provides ethical guidance. And lastly, the Nursing and Midwifery Council, the NMC, which sets a code of professional standards of practice and behaviours for nurses and midwives. The role of professional organisations and trade unions. So these give support and they represent their members, especially when trying to get fair and equal pay. They provide advice for anybody registered to one of the trade unions. It's not required, but it's encouraged. Professional and practical clinical guidance, learning opportunities and other events and things, and training, and they share the same values as regulating bodies. An example for radiographers is the Society of Radiographers. Healthcare regulators reinforce a few things which are important. So the Code of Conduct is a set of professional, legal and ethical rules, which are autonomy, non-maleficence, beneficence and justice. Clinical governance is a framework that the NHS organisations are responsible for maintaining and improving via risk assessments, clinical audit, continuing professional development, evidence-based care, patient and care experience, staff and staff management. Then we have accountability. Healthcare is governed by law and professionals have a duty of care. Patient autonomy, patients' right to be informed and to give true consent. Informed consent, so this is on behalf of yourself if you are able to consent, or on behalf of a patient or next of kin who's unable to give true consent. And then the whistleblowing, which is to raise concerns about unethical, unsafe or harmful practice. Effectiveness of the multidisciplinary team. The multidisciplinary team is where many specialised healthcare professionals can work together to problem solve and pool their knowledge and expertise to achieve better continuity of care for a patient. They do this by having a case conference where the patient usually isn't present to discuss and plan the most effective pathway to treatment. Clinical care pathways ensure the continuity of care between professionals treating the patient. The nursing process is used to assess, diagnose, plan, implement and evaluate. With effective and clear communication and trust, boundaries and compassionate care, the multidisciplinary team can effectively treat patients with illness, either physical or mental, and help people who are being abused. The advantages of multidisciplinary teams is obviously the pool of expertise, so consultants, radiologists, radiographers and nurses, and the radiographers and many resources, so you have lots of resources from all of those different backgrounds and expertise. The patient is always central. You have a large scope of practice, efficient when using the systematic approach with along with clinical care pathways and nursing process. It's easier to achieve the continuity of care. The disadvantages can be that patients can become confused when meeting lots of different healthcare professionals. If the turnover of staff is too high or too many members are involved, this can sometimes waste time or things can be missed, assuming that somebody else is doing it. If there isn't clear boundaries for responsibilities. Difficult to find boundaries of responsibilities within care settings where there is a hierarchy. So the impact of the multidisciplinary team for radiographers and if it's effective. So generally it's very effective. It will increase job satisfaction through a sense of achievement and sense of pride of their role within the multidisciplinary team. Sense of team spirit, so seeing the journey through from illness to recovery. Easier to send relevant patient information and images to the right professional. It utilises specialised skilled radiographers to complement each other's skill set to effectively treat patients. And as Field and Snaith suggest, mixed skill initiatives can encourage and bring rise to opportunities for radiographers to develop and reach their potential. So overall, very effective. And that is the end. Thank you very much for listening.